Hello, welcome back to my YouTube channel. Myself Dr. Atul. In this video, we are going to discuss a topic called anemia. So we will be discussing what is this anemia, what are the cause of anemia, symptoms and types, everything we will be discussing from A to Z. So please watch the video till the end to get more knowledge and detailed knowledge on the topic called anemia. And if anyone is new to this channel, please don't forget to subscribe that one and like, share and press the bell button and enable all notifications so that you will get the notification when we upload new videos. So let's go into the topic. Anemia. So anemia is a condition when our body doesn't have enough healthy red blood cell. So in common man's language, if we are telling, it is a lack of the blood, where our body doesn't have enough blood. So that condition we are calling as anemia. So it may be due to a variety of the reasons, many causes are there. So we will be discussing each in the coming session. So when our body lacks blood, this leads to the reduced flow of the oxygen into the organs and the tissues of our body. Having anemia is referred as the low hemoglobin. So when we feel tiredness, we approach some of the doctors. So usually doctor prescribes some lab tests to do. So one of them is the hemoglobin test, HB test. So what is this hemoglobin? Hemoglobin is a protein that is found in our red blood cells. So which is responsible for the transportation, that is, it transports a healthy oxygen to the organs or the tissues, and also it carries the carbon dioxide back from them. So this can make you very tired and weak. So tiredness and weakness is generally found in people who are having low HB, that is low hemoglobin. So there are many types of anemia. We will be discussing one by one in upcoming. We will be discussing it, and the reason, that is the cause of the anemia, it depends upon the type also. Each type is having its own cause. So we will be discussing one by one, and also the severity. It can be the short-term anemia or it may be a long-term, and the severity also it depends from mild to severe cases. So we will discuss one by one. So let's know what are the types of this anemia. So first one is the aplastic anemia. Second one, the most commonly found, is iron deficiency anemia. Third one is thalassemia. Fourth is sickle cell anemia, and the next one we will just say as vitamin deficiency. So let's discuss what are the cause of this anemia. So this cause of anemia can be broadly divided into two, that is, one is the congenital cause, and congenital cause is something that which is present at the time of the birth. It may be there due to any of the condition or any of the disease condition. The child may have the anemia at the birth stage only, so we call it as congenital cause. He gets anemia due to some of the condition or some of the disease in his lifetime somewhere. It may not be present at the birth, but he gets after that due to some of the cause or due to some of the conditions. So mainly this anemia is found when our body loses the blood. So main cause is we can tell mainly as the lack of blood, or when our body loses the blood. It can be in the form of some of the accidents. So when the accident is more severe, there will be injuries to both the sides, and there will be a loss of blood will be there. So it can be due to the accidents that he gets some of the other causes like heavy menstrual bleeding. It may be another cause, we can tell it as the heavy nasal bleeding, or in the condition of the bleeding piles. And if our body doesn't make enough red blood cells, where production is hampered or production factor is damaged, or when our body's immune system, the immune system unknowingly attacks the RBC, or our immune system unknowingly goes and destroy the RBC, red blood cell, in some of the autoimmune diseases. So these are the general causes. So mainly loss of blood, or the production get hampered, or the self destruction of the red blood cell. So let's discuss one by one the types of anemia. So before that, going into that, let's see what are the general symptoms we find in the case like condition of anemia. The signs and symptoms of anemia may vary accordingly depending upon the cause of the anemia. So some of the symptoms like fatigueness and weakness. So it is normal that when our body, or when anybody loses the blood, so when there is lack of blood in our body, simultaneously there will be lack of hemoglobin, lack of oxygen supply to the organs and tissues. So when our body lacks the oxygen supply to the organs or any of the tissue, there will be a general weakness we can find, and also the fatigueness. So that is one of the symptom of the anemia. Second one, we can notice the pale or yellowishness, pale or yellow color. There may be irregular heartbeat or uncontrolled heartbeat. Mainly irregular heartbeat. It may be fast or may be slow. There will be no regularity will be there. Irregular. It will be heartbeat will be irregular. There may be shortness of the breath. Another symptom is the dizziness. So normally we had seen in our childhood when we go to school, the morning prayers will be there in the ground, so or in the PT period or the physical training, that is PT will be there. So at that time some of the students get dizziness. When they check the blood report, there will be low hemoglobin, low HB. Symptoms and other symptoms like chest pain or the joint pains, bone pain, leg will be there, and also the cold hands and feet. These were the common signs and symptoms which are present in the condition of the anemia. So let's discuss one by one the types. So first let's discuss the iron deficiency anemia. So iron deficiency anemia is the most common form of anemia that we can find. That is 50% of the case we find is from the iron deficiency anemia. So other 50 is the other types. The name itself, iron deficiency anemia. So the anemia which is caused due to the lack of or due to the deficiency of the iron in our body. So in our body, the bone marrow is responsible for the production of the hemoglobins. So when the bone marrow produce hemoglobin, when they get some of the food like iron, so bone marrow needs iron to produce the hemoglobin. So when our bone marrow doesn't get enough iron to produce the hemoglobin, so there will be deficiency of the HB and also production of RBCs. Without adequate iron supply, our body can't produce enough HB for the red blood cells. Without iron supplementation, this type of anemia occurs in the pregnant woman. A variety of factors that contribute to the lower level of iron in our body, they are blood loss. So that blood loss can be due to, I had told previously, the blood loss can be due to any of the accidental case or bleeding piles, heavy menstrual bleeding, or any of the nasal bleeding, that is heavy nasal bleedings, etc. So mainly the blood loss. The second one is the getting less than the recommended daily amount of iron. When we get less iron, the daily amount of iron, one value is there. So when it is below that, far below that recommended value, when we doesn't get enough iron supplement. Some of the health condition that cause the absorption of the iron a difficult process, like IBD, that is irritable bowel disorder. There also are some of the factors that contributes to the lower level of iron. Many people with mild to moderate iron deficiency anemia have no symptoms. They usually detect this while they go for any other checkups, or while they go for routine checkups. So they find their hemoglobin level is less, so they are suffering from anemia. So they doesn't have any of the symptoms, but while they go for any of the checkups, in that checkup they see that hemoglobin level is less, that they are having anemia. Iron, so severe iron deficiency that leads some of the severe symptoms, some of the symptoms like shortness of the breath, fatigue and chest pain, etc. Let's discuss another type, that is vitamin deficiency anemia. So beside iron, our body needs the vitamins like vitamin B12, folate to produce healthy red blood cells. So a diet that lacks these vitamins, that is vitamin B12 or folate, that causes the less or decreased red blood cells in our body. There are people who consume more vitamin B12 rich foods or the folates, but they also suffer from this anemia. That is due to the lack of, or that is due to the poor absorption of these nutrients. So this type of anemia, that is lack of vitamin deficiency, shows some of the common symptoms, that is general symptoms of anemia. The other symptoms which is specific to this vitamin deficiency are numbness and tingling in your hands and feet, muscle weakness, a smooth, thick red tongue, and some of the people also get a symptom like depression. Some of the people have problem with the reflexes or the movements. Some of the digestive symptoms, that is heartburn, gas or bloating, nausea or vomiting, constipation, etc. are seen in the people who are having the vitamin deficiency, who have anemia due to vitamin deficiency. So let's discuss another type of anemia, that is aplastic anemia. Aplastic anemia, it is also called as bone marrow aplasia. So our bone marrow is responsible for the production of red blood cells. This happens when our bone marrow doesn't produce enough red blood cells. So it is caused by the damage to the stem cells which is present in the bone marrow, which is responsible or which take part in the production of the red blood cells, white blood cells and platelet. So when there is damage to that stem cells which is present in the bone marrow, it also results in this type of anemia. So sometimes the bone marrow may contain no red blood cells, that is aplastic. When our bone marrow doesn't contain the RBCs, that is aplastic, and when it contains fewer RBCs, that is hypoplastic. So aplastic anemia, when our bone marrow does not produce any of the RBC or enough RBC, that is aplastic anemia. Aplastic anemia is most commonly caused by a autoimmune activity, during which our body only or our immune system only attacks the stem cells. So what is autoimmune disease? Autoimmune means our body only unknowingly destroys our own cells. So in this condition, our immune system destroys the stem cells. So it also results in the less production or no production of the RBC, less production or no enough production of the RBCs. So aplastic anemia also have an impact on the white blood cells and also platelet, because I had told already the stem cell which is present in the bone marrow is responsible or it take part in the production of the red blood cells. Not only red blood cells, the white blood cells and platelet also. So when a person is having aplastic, he also have a lesser amount of the red blood cells and also white blood cells, and the platelet level also will be varying. So let's see what are the other symptoms which is found other than the general. Frequent or prolonged infection. I had told it also affect the WBC, that is white blood cell. So he have the frequent or prolonged infections. Prolonged bleedings from the cuts. If he is having any of the injuries or cuts, he will have the prolonged bleeding. Skin rash. So these were some of the symptoms that are other than the general symptoms of anemia. These things are found in the aplastic anemia. We had discussed what is anemia, what are the causes of anemia, symptoms, that is general symptoms, and types. In types we have mainly discussed the aplastic anemia, iron deficiency anemia, and nutrition deficiency anemia. We have discussed the symptoms along with it. So we will be discussing the other type of anemia as a separate video. So by this I am ending this video. I hope you like the content of the video. If you like, please share maximum and support us. Also you can see our description box. If you want to consult for any of the problems, you can consult our team. That is, you can see our description box. There detailedly we will be giving what is the procedure of that. Thank you for supporting us.